So welcome to episode 1 of a series we're doing each month here at Neurvana Health, where we take a look at certain conditions and how neurofeedback and functional medicine help with treating and solving this condition. To my left I have the star of the show, Deacon, and Corey is a functional medicine practitioner and a neurofeedback clinician. He has a doctorate of natural medicine, is an alternative medicine practitioner, a registered traditional naturopath, a neuroscientist, and the author of Your Brain on Oils, and is currently completing a fellowship in anti-aging, metabolic, and functional medicine from the American Academy of Anti-Aging Medicine. So Corey's a pretty smart dude when it comes to healing your body.
You went through that a lot better than most people do.
Yeah. So Corey, how are you doing today?
Great. Yeah, happy to be here. The sun's shining. It's
Awesome.
Great.
So Corey, today our topic is about cancer.
Mm-hmm.
And I know this is a topic that is really kind of near and dear to me. I've had family members pass from cancer, and even myself, a number of years ago, I was misdiagnosed with cancer. And there's about a 2-year period where I had no clue. I just was living in fear, and wish a guy like you came into my life at that point. So, and it really wasn't until I started looking at natural means, different natural alternative modalities for healing, that I realized that I didn't have cancer.
Right.
And so today, hopefully we're going to go through and we're going to debunk a few things, and hopefully some of our viewers are going to have a couple aha moments. So just to dive right into it, I want to kind of set things up with a mindset. And now there's clearly a lot of schools of thought around cancer. And can you first walk us through what's the current mostly adopted school of thought in the conventional means, and then exactly how does functional medicine view it? How do you view cancer?
Right. I mean, it depends who you ask. The main school of thought that's most widely accepted, of course, is the conventional allopathic school of thought, where we need to go directly after the cancer.
Like
right?
Target it.
We have to target the cancer. We got to do everything we can to target this type of cancer based on this diagnosis, and it's very empirical. And the way that I describe empirical is, it doesn't necessarily mean that it's precise. What it means is it's based on evidence of a big group of people that have the same diagnosis, that have been given this particular drug A, and maybe in combination with drug B, and we see the effects of it. How many people survive? How long do they survive for? What's their quality of life while they're going through the treatment process? What's our toxicity? And so we call this the empirical approach to cancer.
Okay. Not to interrupt. Allopathic, I'm sure some people aren't going to know what that really means. Can you just describe that?
Yeah, so allopathic care is conventional care. So drug-based, generally pharmaceutical-based, surgery-based, right? So you need to be a medical doctor, right? You're an oncologist. You're going to be treating cancer directly, right? There's not very much that goes on to help the body, to assist the body, to look at even maybe possible things that might have caused it, right? We don't have time in that model of acute care to deal with those types of things or even ask those questions. We just go, well, our protocols say that this is our type of cancer, and these are the approved treatments that we can do based on that type of cancer that you have. If you have breast cancer stage 3, here's the treatment. If you have cholangiocarcinoma, which is gallbladder duct cancer, stage 4, here's the treatment. Or in some cases, unfortunately, there is no treatment for you. And that, unfortunately, is a lot of people that I see are the people that are, essentially given a death sentence and an amount of time that they have to live.
Right.
And there is no treatment for them. Or there is palliative treatment, which essentially means we're going to do what we can and see what happens and see if we can minimize that. And it's a very limited model when you look at how cancer behaves, because if you and I have the same type of cancer, it can still be behaving very differently. but we assume it's not. And so we're very limited in that view, and we call it the empirical view. I call it the limited view.
Right.
For lack of a better term.
Sounds like it. I mean,
Mm-hmm.
it's sounds very rudimentary. I mean, you're just kind of chopped up and characterized based on one characteristic of that cancer, not necessarily based on the individual. And I think that's where we're crossing over into your world now.
Right, where you're working instead of treating a disease, which I mean legally practitioners like myself can't do. We're working on treating the person, right? Cancer adds a layer of complexity. We'll probably get to that later, but it's more about looking at, okay, what was there that shouldn't have been there, that could have drove this cancer process, right? And we're never going to know 100% what caused somebody's cancer, but we know a lot of driving factors that are present in toxicities and infections and gut issues and trauma. The adverse childhood experience study that looked at childhood adversity found high levels of cancer in people that had childhood adversity. The more childhood adversity you had, the higher level rates of cancer.
And that's definitely not something that the allopathic, traditional, conventional means even. They don't even know it exists. I'm a guess.
I don't know how many people in that as an oncologist would know that, because again they're focused on treating cancer. They don't treat trauma, right? They don't assess it. So again, the idea is someone gets cancer, they have cancer, that's it. We don't care about anything else. We just need to kill the cancer, right?
Right.
That's kind of the model, or remove it with surgery.
So really, it sounds like the allopathic means is an aggressive attack. It's a mentality to go after it.
Right.
Whereas going into the functional side would more so be looking at what's happening with the person, what caused it, and I guess addressing, like the way I think of it is like addressing the terrain, I guess, or the
great term, exactly, the terrain. What is the underlying biochemical terrain that not only maybe caused it, but also what allowed it to persist, what allowed it to grow, what allowed it to proliferate, become aggressive, and metastasize. Right. So yeah, you're looking at all those factors, and then on top of that, you're also looking at how's this cancer behaving, because cancer behaves in, well, the 10 hallmarks of cancer. This just kind of got solidified 8 years ago, and it's actually was incredible research that really has driven a movement in different types of drug development, which is amazing. But it's still very limited to your diagnosis. So
what's that? Can you break that down a little bit? Like, what is that? What does that study look at?
So the study looked at different types of cancer, and essentially what they were looking at was the epigenetic expression. So how is that cancer behaving? And what we've found is there's around 10 to 12 ways that have been solidified now in the literature. So there's a big meta-analysis that combined a whole bunch of different studies. That there's 10 to 12 ways that cancer will behave. There's ability for cancer to release growth signals. So normally our growth signals come from other places, right? The gonads, the brain, pancreas. But instead, cancer all of a sudden starts acting like a gland, and it can stimulate its own growth, which is interesting because normal cells can't do that. It also is prone to desensitization, or it doesn't respond to anti-growth signals that stop the growth.
Okay. Could you describe what is anti-growth?
Essentially, it's the halting a cell cycle, so stopping a cell division. Cancer divides rapidly, so you'll have one cell and you can have hundreds, sometimes within minutes, depending on how rapidly it's growing. And normally, under normal circumstances, a normal cell, if it grows too fast or divides too fast, there's signals that tell it to stop growing so fast, right? And we have cell suicide. Our cells are very smart, and they're not selfish. They'll commit suicide if they're dysfunctioning. But that factor has broken down in cancer. The other interesting thing is cancer cells are immortal, which is, again, not a normal cell can only divide about 50 times.
Okay.
There's a
Immortal?
limit.
Like
Immortal.
They just keep going.
They can keep dividing and dividing and dividing and dividing to no end.
Wow.
So there's 12 of these. I have a lecture on it.
Okay.
And,
I'll probably link that.
And we can maybe throw the image up of the 12 factors,
Yep.
and people can take a look at that. So there's all these different ways they behave. So up till that research kind of started putting all that together, we were just kind of going after the fact that, well, cancer divides fast, so let's get a drug that stops that fast division, right? And then you see all the side effects, right? Immune suppression, because our immune cells also divide quickly, and drugs aren't able to specify what's a cancer cell and what's a healthy cell, right? Our hair cells, why do people's hair fall out with chemotherapeutics and radiation, right? You're attacking all fast dividing cells, right?
That's interesting.
Some people end up sterile because egg and sperm cells are fast dividing as well, right? So there's a lot of side effects that come from that too, and a lot of toxicity.
So how does the functional way of viewing cancer specifically, how does that differ really from say like naturopathic medicine or TCM or any of the other alternative measures?
I think the best way to answer that is actually talk a little bit about my own experience on that. I had a cousin who passed away of cancer actually very quickly from point of diagnosis, and what I started seeing was again a big disconnect in the world of Empirical of what the oncologist could offer him. And I started researching because I was in medical sciences at the time, and that was what I was taught to do. So I started researching and finding all these amazing things, and every time I'd bring up something, it would always be, we can't do that because it's not approved for this type of use, right? And so I started getting interested. It started becoming more political, right? In a way, to me, I'm like, oh, okay, so you're not denying that this could work, but you can't do it because it's not in the protocols, right? So I went over to the naturopathic side and started studying and learning everything about naturopathic oncology that I could. And, I saw a lot of advantages on that side because it was a lot of, less toxic therapies, right? So you could be a little more aggressive, supporting the body from toxicity, which is important, right? And then also kind of a similar approach where they assume that cancer is behaving a certain way, so they use these different therapies and adjuncts based on that assumption. So on both sides, there's a lot of assuming going on.
So even though it might be more herbalistic, natural, away from the drugs, it's still falling into that same frame of mind, if you would.
That the empirical approach of, you have this type of cancer, here's our treatment for it, right? So when I stumbled upon what I best describe as functional and integrative, I don't know everybody's view in the functional integrative world. My viewpoint on it is we need to look at underlying terrain, and we need to look at how cancer is behaving. And as you'll see on the diagram that we'll put up, you have a layer of complexity where there's things that we need to have in our body, and we need to assess them. We can't assume that they're there and working. There's things that we shouldn't have, like infections and toxicities and trauma, and even just the diagnosis of cancer, and I'm sure you went through that over 2 years, creates trauma in the brain, and trauma automatically causes an immune system dysfunction. What do we need to clean cancer up? An immune system that's balanced. And then you bring the other layer, which is the tumor behavior, and look at, okay, now we've figured out what's going on underlying that's maybe allowing this thing to proliferate. Now let's look at tumor behavior. What's going to work against this cancer, right? Well, how is it behaving? Because there's thousands of agents that you could be applying to go after that cancer. And whether you're on the natural side or the pharmaceutical side, you need to know what to use, because you can't just throw everything, throw everything at the person, because they're not going to be able to tolerate it.
Gotcha. So would you say that the more conventional means, then it's sounding to me like it's looking at it from a very dated model? Is that
for sure?
That's been your experience?
Yeah. And I always find it interesting how we call that is the conventional model, and the other model is the alternative, because the alternative has been there a lot longer.
Right. Yeah.
Modern medicine's only been around for about last 100 years or so, but we call it conventional.
Right. Yeah. Yeah. I've never thought of it from that perspective.
Yeah, it's interesting, but there's a lot of these therapies that have been around for years, but we now have the means to be able to test. I mean, we can even test cancer cell stem cells and see what they're going to respond to. It's not a perfect test because we're looking at cancer cells outside of the body, but we're seeing what's going to actually work against that cancer. How efficient is a compound like, say, artemisinin going to be at reducing cancer cells, and we can actually measure that.
Right.
We call it an in vitro test, because we're pulling the cancer cells out of the body, and then we're applying agents to them to see, okay, this didn't work at all.
Right.
So people can make better educated decisions about, do I go ahead with the chemotherapy that's being recommended? Because sometimes we've seen the chemotherapy that's being recommended for the cancer is giving 0% reduction.
Right.
The cancer is completely chemo resistant to that type of drug. So now people can make an educated decision on, okay, this isn't even working against the cancer I have, and why would I go through all this toxicity, just in hopes that it's going to work, right?
Yeah.
Very powerful, because people do have a right, and I think sometimes the modern model makes us think we don't. We have a right to choose, and we have a right, if we don't feel like chemo is right for us, we can go do something else.
Yeah, that's
right?
very key, right? Is that seems to be forgotten.
Mm-hmm.
You see all these cases with even like young children where they're at the age of reasoning and they can make their own decisions whether they want to keep going with treatments, and they get pulled into court, and things like this that you hear in the States, at least. I don't know, I don't have the source, but I just remember hearing these stories years ago, and similar ones like that, and it is a very, I could just call it rudimentary. It's just very structured. Yeah. And limited, I guess.
Yeah, and it was really the biggest problem with it is we've had a surge in chronic illness that was never there. All of conventional medicine, and even natural medicine for that matter, worked fairly well in that process where, hey, you have this symptom, like, here you go. Right, but now we've just developed so much chronic illness. It's happened so fast. It's completely overwhelmed the system. The system was set up for acute care, and now it's trying to manage chronic care.
Right.
And it's not set up for that. Right. So that's why we're failing chronic care cases like cancer, like Alzheimer's, like fibromyalgia and autoimmune conditions, is because the system's not set up to take care of it.
No
right?
kidding. Yeah. How do you think we got so many we got this polar set of opinions?
Yes, that's
without being too.
I was gonna say, do you want the philosophical view or the? It really started with there was a handful of people back around the World War I. Started looking at certain chemical compounds and extraction processes, and there was a level of patentability, which was economical. So a lot of it stemmed from that, right? We can create something for us that nobody else can create, that nature can't create on its own, that I can patent. And now
during that time, that would have been a huge deal, right?
Huge. Well, and we have penicillin.
Yes.
Like, amazing. It's arguably saved mankind.
Yeah. Some people argue that that was the only reason that the Allies won the war.
Right. Right.
It was,
I don't disagree with that. But I think what we tend to do as humans as well is we go, well, this worked, so let's keep doing it. Right. At some point, your luck runs out, and that's what's happened.
Right, just a little bit short-sighted, I guess.
Short-sighted, exactly. Like, the magic pill. Everything always gets more complex as you learn more, right? And so there's always this. Maybe we can bring Charles Darwin back to life in the future, and we can ask him his opinion. But
that'd be cool.
I find it. Yeah, it's so. I think that's mainly where things have started.
So let's get into what is. I guess we've defined kind of how to look the two different views of cancer. How would you define what it is now, and you know, what it really is. I mean, it's still a lot of people talk about it, but they don't understand what exactly it is, I guess.
Right. So, yeah, in my to keep it as simple as I can, I guess, cancer is a group of abnormal cells that are behaving in a rogue fashion. They're not reacting to signals from the body. I like to say they're like a little misbehaving kid. Right? They're a misbehaving kid that has the ability to create more misbehaving kids. So they're not listening. They're not reacting to any signals from their environment. They're just kind of going. And the other thing is all cells have a deep down cell survival mechanism. So every cell, we have it, right? What happens if we feel like we're in danger? We do what we have to do to survive, right? That stems from a cellular level. Our cells do what they can to survive, right? If they find that they're affecting their ability to survive is affecting other cells around them, then they'll commit suicide, which is, you know, just like such a brilliant form of symbiosis, right? Bacteria will do the same thing in a lot of cases. And so we have this ingrained cell survival mechanism. Well, cancer has it too. So it's almost like a misbehaving kid that doesn't realize he's misbehaving. So it just keeps doing this. Cancer cells keep doing the same thing over and over again, and they're trying to survive. We're plowing, firing in drugs at it, and it's still trying to survive, and it's good at it. Just like our cells are, just like we are. We're very good at surviving. And so that's my best definition of cancer, is it's these rogue cells that are doing their best to survive and thrive, and they don't realize that they're not working as a unit with the other cells in the body anymore.
So where do you think then where does it really come from? Where does it stem from, and why would so many people have it? Especially, it seems like as we get further into the modern day, it's like more and more, the curve on the graph is almost a hockey stick, right? It's getting pretty up there. Yeah,
so there's two viewpoints on that. Is are our cancer rates increasing, or are we getting better at finding it, right? With dysfunction, you know, my view, of course, is there's going to be a good amount of percent of those cases that we're just getting better at finding, which is another philosophical argument in itself of when is, you know, finding things a little too much. When does stress actually make things worse, right? But there is, even weighing that out, there is a massive increase in it. So there's a handful of things that we've seen. I mean, environmental toxicity. You can't even argue that anymore.
What would that include?
Environmental toxicity, you're looking at pollutants. So our air, volatile organic carbons, mold. Mold has become a big problem because of the efficiency of houses. Now again, we think it probably was a problem a long time ago as well, but again, we didn't see it, know it, right? So this indoor pollution is, especially in northern hemisphere, a big deal, right? We're locked inside these rooms. They're not mold proof. They're highly efficient as far as energy goes, but they don't breathe well. So we get any moisture problems, any humidity problems, and we're in trouble. There's, you know, heavy metal contamination that's still going on in the environment, and we've been doing that, you know, since the lead paint days, mercury days, right?
Leaded gasoline.
So
which I'm told is still used in South Africa and different parts. Yeah.
Third world countries still use a lot of leaded fuels. Right. Prevents engine knocking. We have hexavalent chromium toxicity in a lot of the water that's causing cancers. We have a lot of water toxicity.
Hexavalent chromium?
Yes, it's a toxic form of chromium.
Oh, where does that come from?
There's places that have high levels of chromium in the water, and what happens is when it's oxidized, it turns so chromium. No, we need it. We need chromium in something called trivalent form. It's chromium 3+. But when it's oxidized, it goes to 6+. and it has 6 electron levels. It's called hexavalent. It's highly toxic. There is a few cases in the States. Actually, I don't. The movie Aaron Brockovich.
Right. Okay.
That,
with Sandra Bullock.
Yeah.
Right, yeah.
That was a case of hexavalent chromium toxicity that was causing cancer.
So does that then mean it's all really exclusive to people that are around big industry? Like,
yes and no. I mean, we also, when we really dig into the nuts and bolts too of our model, is we're also looking at trauma, emotional trauma, which is probably one of the most underdiagnosed problems I've seen. We don't, up until the development of quantitative EEG, we couldn't even really screen for it, right? We also see issue like our stress has never been higher. Our self-care has never been lower.
Why do you think that is?
I have a few theories on it. I mean, our culture is kind of built in a fear-based way, right? If you don't do this, then this. If you don't succeed, then this. It drives a lot of very successful people, but there's the shadow behind it of stress and am I going to fail and am I going to keep a roof over my head, and we call it here, of course, we laugh when we say it's first world problems, right?
Yeah.
Really, am I going to be okay? Yeah, but something in my brain tells me I'm not going to. You have a lot of undiagnosed infections going on. Our guts are in bad shape, right? We've been using Roundup in the amount of billions of tons of it since the late 90s, early 2000s.
And it's actually, I was going to bring that up, is the food. I mean, what role does that really play in I guess creating it and or maybe advancing it?
Well, and also healing it.
Healing it, okay. Yeah.
So with our food is problematic as well because this is actually where we started seeing disease rise, by the way. We'll show the graph, I hope, in the video. Yeah. We see chronic disease rise in the industrialization of farming. So we can produce more. Why do we do summer fallow, right? Mm-hmm. Why don't we just force the soil to grow what it should, right? And as soon as we started industrializing farming, we started seeing lower mineral and vitamin contents in the food, and we started seeing disease coming up. When we started using fertilizers, just the more that we've forced the soil to do things that it doesn't want to do, the more we're able. It's brilliant. We're able to. There's food sitting there. It's food, right? But you look at the mineral and vitamin content, and we're not getting what we used to. Yeah. And so that's one of the big problems, because what do we need for our cells to process properly? Minerals, right? Our enzymes are literally signaled by minerals to do what they're supposed to do. They just sit there like a pylon if someone doesn't give them an order, right? And minerals are what give them that order to, okay, you move and go do this, right? Vitamins, aminos, right? They're building blocks of our body. There's so many things required for our body, and the big one is for detox. So we have this double whammy of not getting enough of what we need to detox and extra toxins, right? So now you're hitting, like you said, upward hockey stick, right? So that's the two things I see with the food is now we have mandatory processes. I know in Canada, I'm not sure about the states and where they're at with it, but we spray wheat with glyphosate, which is Roundup, which is confirmed by the EPA to be carcinogenic now.
Correct. Yeah.
We douse it before it's harvested, right? There used to be the thought of, well, by the time it grows, there's no Roundup left. But we're dousing it before its mandatory process is dousing it before it's harvested. And we're getting that, in Canada and the States it's a staple. Yeah. Right? Wheat is a staple.
Yeah, even where we're sitting right now, all around us, farmers. Yeah. It's 80-90% of.
So you have a lot of that. You have organophosphates and insecticides. So when we do toxicity testing, these kinds of things are almost always coming up. I've actually stopped testing for it a lot of the time.
Just because it's that predictable?
Just because it's that predictable. I do run it in complicated neurological illness and atypical neurological stuff, tremor, ALS, that sort of thing. But In cancer, you just kind of assume there's a level of toxicity there, and you go to work and cleaning it up, and educating people on how do we remove our exposure, because I guess we're never going to remove our exposure, but we can limit our exposure greatly. So
we talked about food, pollutants. Now this is something that doesn't seem to get a lot of attention, is say radiation from electronics. It seems to be a big deal with 5G rolling out. It's those 300 birds dropping dead in the Netherlands, and just more people becoming a little bit more aware. That 17-year study completed recently by.
Yeah, that's something that I've been educating myself on a lot the last couple months, because we've had this research kicking around here and there, and people have picked up on it, and they've done a study here and there, but the National Institute of Health picked it up, did a 17-year study, and they're one of the most funded agencies on health in the world, right? So if they want to study something, they get the funding and they study it well, right? You tend to not argue with the National Institute of Health when they have findings. They're quite good at what they do. And so once it was peer reviewed multiple times, it was released, and it was, it was eye opening, and some would say frightening, of what this, and we're calling it the new hidden toxicity, right? We're carrying these things around with us. I don't actually have mine on me looking at it. I've been very careful about that now. But we have these microwaves essentially that we carry with us everywhere, right? And so to break down the toxicology reports that did come out, again, it was animal based. Ethically, we can't remove and expose humans to this stuff, so we have to take it with a grain of salt, of course. But in the animal studies, there wasn't a lot of probably the most frightening thing was there wasn't any evidence of blood markers being different. So at this point, we don't know how to exactly measure.
What does that mean?
What's too much
for a blood marker?
So when we look at a blood marker, your doctor takes a blood test, right, to look at what are your white blood cells doing, what are your red blood cells doing, how's your liver functioning, how are your kidneys functioning, what are your hormones doing, right? It's just kind of it's a simple, easy way, we call it hematology, to study the blood and start picking up, ooh man, there might be issues going on here. Well, in the end of the study, the animal is exposed to high levels of RF frequencies, and there was not any difference significantly in any of the blood markers. The one thing that did stick out a little bit were menstruating females were having hormone abnormalities. There were significant hormone abnormalities and regulation abnormalities. Again, another big issue in our modern day culture is that women are having a lot more issues with hormones. A lot more infertility, a lot more endometriosis. That does seem to be a big
thing recently, doesn't it? Like with infertility, seems to be an industry that just sprung out of nowhere in the last 7-8 years.
And then back to the cancer topic, hormonal cancers as well. Right. So there's genetic weaknesses, and I guess it's important to talk about that. But what are we doing now that we weren't doing then? That's taken us to where we are, and that's the questions we need to be asking. And when you ask that question, you get quality answers. I always say your answers are based on the quality questions you ask. Actually, Dr. John DeMartini says that, but I love it because we just haven't asked the right questions up till now. What we've been asking is, rather than what's causing it, how do we treat it? And it's just gotten away from us, right? So back to that. I got a little squirreled there.
Well, I guess in to fit into that, it's not just the electronics, like the giving off the radiation, but as these studies are rolling out, it's something to do with the light as well. And this is why you have these beautiful shades on right now, right? Could you just talk about that a little bit?
Yeah, for sure. So what we've come to learn now, and I'm by no means an expert on this, but I've gotten a little bit into the literature now on it. We aren't living with the sun anymore. We're not getting full spectrum light. We're scared of UV light, right? We think that UV light's the reason for cancer. We're always looking at our computer screens, our phone screens, right? So what's happening is our brain's always getting told, because blue light tells our brain to shut off hormone production. So we're being told all the time that, you know, it's time to wake up and essentially stop any sleep processes, any repair processes, any regeneration processes. And that's of course through the retina to a part of the brain called the SCN. So our sleep's disrupted, which is probably arguably one of the best healers, right? And then we're also, our cells melanopsin has the ability to respond to light, but it responds to it based on the spectrum that's being distributed. But our cells have melanopsin in them that also responds to light in a good full spectrum, right? And this is where, if you look at studies of, you know, people who do tanning and UV, right, you're hitting yourself with pure UV. You don't get the other spectrum that's very important in making sure that cancer's not triggered.
So UVA, UVB.
Right, exactly. And then you have a whole other spectrum of all, you know, infrared, microwave, visible light. Like it's a wide spectrum, and it all provides certain feedback to cells on how to behave, which I find really interesting because we've been trying to target it at the biochemical level, which is highly complex. The light level is actually simpler, right? And the other thing is we all wear sunglasses now, right? What do we blocking UV light? Even if you get the full spectrum bulbs in your house, it's not full spectrum because we're pulling UV out because we keep thinking it causes cancer, right? So burning your skin constantly, yeah, it's gonna cause some cancer. But there's ways that you can go based on your behavior. You can go out into the sun without using large amounts of sunscreen and be good based on your kind of prepping your cells and warming them up. If you go out into the middle of high noon, you're probably going to burn, right? And this is a big reason behind cancer, but it's not, from what we see in the good studies, it's not the UV light, right? So it's just what we've been told, and it's been an old protocol for a long time.
Do you think that's something that's been told to sell sunscreen or sunglasses or
could be maybe on episode 100 we can talk conspiracy theories.
Yeah, we don't want to be too
yeah, you know, and there's always anything that happens and any consequence is going to be a opportunity for economy, right? An economical advantage. It's for sure. And then we try to keep the status quo.
It wasn't that long ago that we seen cigarettes apparently good for your health, came from some doctors as a prescription even, right? I mean,
totally.
I didn't live that long ago, but I remember seeing all that stuff happen in 60 Minutes interviews, and which just seemed absurd. So it just doesn't seem like a far stretch. Like in this, I think on this show is like we're not going to be spoon feeding, I guess, the generic, typical stuff. Like,
right.
This is stuff that needs to be talked about, and so it's, you know, whether it piques our viewers' interest or not, but
or whether it creates cognitive dissonance or not.
Correct. Yeah.
Sometimes it's hard to hear. It's hard to hear things. Our belief system wants to take over and tell us everything's going to be okay. But it is important because I tell every client I see, well, you need to take your health into your own hands because we're too far behind and we're too caught up in these companies that are really good at keeping the status quo for us to get any change. And so it is important to know this stuff. You know, and I think that's a big thing too. Is you get some companies. You know, we could talk about the wheat board, for instance. They are very good at keeping the status quo, right? We don't want to hear, a whole industry doesn't want to hear that, you know, we've overdone something or we've crossed the line.
Right, like jobs at risk and stuff.
Totally,
yeah.
And you're right, in people's lives, right? So it's difficult. It's not, I mean, it's hard enough for us to change our habits as on an individual level. You know, you take it to a community level and it's a whole other layer of complexity. So, you know, the conservative view is sometimes sits the best with people, right?
Yeah.
It's the easiest. We don't need to change anything.
Yeah.
Our brain doesn't need to change. You know, we're all good.
We'll just put little hooks out, and people can research a little bit further if they need to.
Totally, and that's where we need to empower ourselves with this knowledge and now go, okay, what do we do with this now, right? And that's what we do at Neurvana is we help people. Okay, what do I do now? Where do I go now? How do we move through this journey we call healing, right? And we're all going through it. Some people just don't realize it.
So that kind of brings us to the next piece here is how do you detect it? I mean, we've got mammogram machines, and we've got all these other things that we've heard about for a long time. But we've also got stuff like thermography, and we've got all sorts of stuff. I mean, where do you see as best? And
right, I think every diagnostic imaging brings a unique angle to the picture. So you have mammography. I mean, they're going to pick up an active process, right? Ultrasound can even be really good. Generally, I like the ultrasound as first line. Some people are even able to talk their doctors into doing a preventative ultrasound where you do an abdominal lymph node array, right? If you're gonna get cancer, most of the time it's in through here, unless it ends up being in the brain, and that's a different issue. But ultrasound tends to be best first line because you can detect with a pretty good degree of specificity, and then you can get a follow-up MRI or a CT to really confirm, right? Mammography could kind of come next as far as breast cancer screening goes, right? Now, are we getting exposed to radiation? Yes. We're still trying to hash out the argument of if that's too much, if an annual mammogram is too much for somebody, so which is why I like the ultrasound.
Right, no radiation. Well,
no,
very little
sound waves, right?
Yeah.
It's not, there's, unless you had really, really, really high amplitude sound waves, you're not going to damage anything, right? So, and then you have your procedures like thermography, which is going to show someone who's at risk for developing, which is really where you want to catch it. You want to catch someone that's at risk. We have other markers of DNA damage, which are brilliant. 8-hydroxydeoxyguanosine. It's a mouthful.
Yeah.
But essentially it's a marker of DNA damage. And if you can test it in the urine, so it doesn't even need to be an invasive test, and you can start seeing if someone's having a high degree of DNA damage, and then you want to get to work. What's causing this? How can we clean up the environment? How can we clean up what's going on in your body, your diet?
Right.
Start looking at stress, that sort of thing, so that we can catch this stuff. Because I've seen nasty cases, right, where you're already stage 4, and if somebody would have ran one of these tests 20 years ago, you might not even have been in this mess, right? And so it's hard to get across because our measure of health is pain. So if I'm not in pain and I don't have cancer, I'm healthy. And that couldn't be further from the truth, right? Your issues trigger when your tank overflows, right? But that tank is building up crap all the time. So we have cool tests like that. Oxidative stress tests are really good. You can look at cancer antigens in blood. I don't like the accuracy of them because a lot of times people look when they're low and they go, oh, I'm good, right? By the time a cancer antigen goes too high, again, you're kind of looking at the scenario like, okay, well, we've now already developed it. We're launching an awesome program where we're going to be looking at cancer stem cells, because almost everybody's going to show some level of cancer stem cells, right? 1 in 3 of us are going to get it, our generation, which means everybody is going to deal with it, either directly or indirectly. Family member, a loved one's going to deal with it, or you're going to deal with it. So we're running cancer stem cells, circulating stem cells in the blood, looking at how they're behaving and looking at what's working against them, so we can start looking at preventative strategies based on those circulating cancer cells. And that's something like I'm personally doing for myself, because again, like we're looking at high probabilities here in the next 20, 30, 40 years, right? So that's, in my opinion, the best, is looking at, okay, what there's cancer cells in your body. Let's just be upfront about it. Let's not be scared about it. Let's look at how they're behaving, and let's get some preventative strategies in place.
So is that something you would do every once a year? You'd come in and run it?
Right. Yeah, annual. Yeah, and we're I know we're going to be bringing a brilliant woman out hopefully soon to talk about budgeting these things into your life, because this is something we haven't up till now really even thought about, right?
Yeah.
Is, man, am I actually gonna have to budget healthcare into my expenses, and especially in Canada,
Yeah.
we're taken care of, right? It is what we think.
Yeah.
But the problem is it's reactive. We're not taken care of until we're sick, and in some cases it's too late.
Yeah, even in my own personal case, that was kind of the big changing moment. Was the misdiagnosis occurred, and then it was really, everything began with the mentality side of things, where it was, okay, well, I can just sit back and see it, ride it out, see how it goes,
Right.
put it onto someone else. Instead, I chose to own it and really just work through it and make it my own, I guess. And take those preventative measures, but at least budgeting it in. Right away it was like, okay, well, everything's got to be organic. Like, let's just start ruling stuff out. Let's take all these measures, and because insurance didn't cover it, even though I had some pretty sweet policies, and so it just made me really, I guess, rethink that whole process, when I should be preventing, I guess, like you said, it's a way better approach.
But we don't know generally as a population how to do that. Right, we're generally learning our stuff through marketing. We're learning about what I should and shouldn't eat through Facebook, or what I should and shouldn't eat from a book that I picked up at Chapter. Right, we're lacking the application. We have more knowledge than ever, and it's everywhere. It's amazing when I go down a path, and the amount that I can learn is brilliant. But if you can't get to the end of that path and figure out how it applies, then what do you do with it? And that's where conventional medicine is right now. Is they're almost froze because they don't know how to adapt all the knowledge that's out there, right? We don't know how to do. We're struggling. I mean, almost every second person I talk to, they don't know what they should or shouldn't be doing, and they're overwhelmed because the
like, stress reaction.
Right, and they start second guessing because now they saw a piece of information that conflicted the behavior they started doing, and it's enough to drive you crazy. And I went through that myself when I was on my health crisis. Guys like me are always wounded healers. We do what we do because we struggled, or someone close to us struggled. But I remember going through that same process, right? Well, what do I do about this, and how do I apply it to my life, right? And do I even need to apply it? Does it even apply to me, right? So
right.
Those are questions that we've now been able to position ourselves to help people with, and really help them weed out what is helpful, what's not, and learning how to actually apply that, which is, I think, the most important part. Is now we have all this info, how do we apply it?
So yeah, how do we apply it, I guess, is the natural question to ask. Is someone, say someone's watching this and they maybe been diagnosed or just told that they may have cancer. Like, what would be that next step if they are not willing to go through the pain and suffering? Maybe they've seen friends and family go through the conventional model, and maybe they're just more open to a natural way. They want a better way. What would they do next?
Yeah, so, well, I always say whether or not they're going to go do things differently, or they're going to do things as we've kind of been doing them for a while, conventionally, I always tell people to take a breath. Take a breath. Anybody who's ever been in a cancer clinic, it's like, I don't know, it's eerie, your gut is just like, and it's just a terrible feeling. And the other thing people have to understand is medical doctors are scared too. This thing is scary for them.
And fear is transferred via pheromones, if I remember. Like it's highly contagious,
and,
right?
And brainwaves.
Brainwaves. Oh wow. Okay. Yeah.
Interesting brainwave coherence.
Another video.
So I always tell people, take a breath. Okay. You no matter what you're dealing with, you have more time than you think or than you're being told. Just take a breath, because we need to make decisions from a stable state of mind. We don't want to make decisions out of fear. And this is one thing that we work a lot with, the neurofeedback and the brain mapping with people. Every cancer client that comes in gets one, because I need to see and assess the level of trauma and stress that's going on in the body.
Could you just describe that a little bit more? When you do a brain mapping, what does that look like? What's the tool that you use?
Oh yeah, so we use something called the quantitative EEG. It allows us to quantify brainwaves. So you sometimes see with all the movies with all the wires on the head, right? We have a little bit faster, more efficient version to pop on people's head, and we just look at what's your resting brain state compared to other men or women your age. And we can start picking out patterns of when people are in that survival fight or flight mode, which is natural, right? But our fight or flight mode was only built if we were being chased by a bear or a predator, right? Minutes, maybe an hour, right? And then we come out of it. And that's how our body healed. But now we get stuck in these responses of disease like cancer. We're trying to fight something like cancer in a maladaptive way, and it just means, what that means is bad adaptation. It means that our stress response is built for short stressors, not to fight a disease. So we need to get out of that. We need to, even though it's cancer, and this word is scary, it's inflicted fear into our culture, it doesn't need to be, and we need to teach the brain that there isn't an immediate threat, because it will, if it acts maladaptively, we won't be able to get the immune system to balance real well. So that's what we do with the nervous system assessment that we do, and we get one on every client, because it doesn't matter what you're dealing with. If that's going on, you're not going to get where you want to get to. So that's...
Do you think that there's... So you were mentioning earlier that each person is different. Even though they have the same cancer, you're going to be... Your level of treatments and type of treatment might be different from someone else's.
Totally.
So
and your prognosis can be different, and so back to the what do you do if you're wanting to pursue something different? So take a breath, remind yourself that people here heal from cancer all the time, right? Don't make yourself a statistic, because you're not. You can be an outlier. Anyone can be an outlier, which means that you survive way longer than you're supposed to, or you survive forever, right?
Yeah.
And so you remind yourself that, and then get educated. Get different opinions.
Educated. Does that mean like reading online, like say different blogs and stuff, or?
Yeah, I usually tell people to refrain from that.
Why is that?
Just because a lot of those are experiential based. So somebody will write about their experience, which is great, but a lot of times unconsciously we transfer that into our own and say, well, I should be doing this then, and that's not always the case, right? But I think it's important for people to get empowered. There's Dr. Kelly Turner writes a book on cancer that I think everybody needs to read. What's
the book called?
It's called Nine Ways to Heal from Cancer, I believe is the title. I can confirm that though. But Dr. Kelly Turner, cancer.
We'll have probably links in the...
Yeah, for sure. We'll have to do that. And just get yourself empowered. And then the next step is to, again, if you feel like conventional is right, then you do that. But I always tell people, make sure you understand there's a level of toxicity here. It's not looking at cause. It's not looking at underlying terrain, right? Some people go into emergency mode, and they do that, and they like to do that to get, see what we can get, if we can get ahead of it. But ultimately my view would be going through a process like ours, where let's figure out how this cancer is behaving, and let's figure out what the underlying terrain's doing. Why is your immune system not cleaning this up? Why is your body not keeping it at bay, right? And what's there that's driving that?
So is that, maybe you can go into more depth, and like what would that process be? Someone comes to meet with you to work on getting through the cancer. You briefly mentioned it, but could you walk us through those steps?
Yeah, so they would come and they'd get a brain and nervous system assessment. This would include a cognitive assessment in case we decided to go ahead with chemo or something like that. Cognitive issues are a big side effect of it. They would come see me, we'd go through medical records, we'd look at their pathology reports, we'd look at the treatment plan, we'd look at some blood work. It's always very superficial, the blood work that's ran. It's a small panel. Because it doesn't, any other info wouldn't change how they would treat that person. The only within the medical model, especially when you're in a public system, if a blood marker won't give you any info that will change how you treat, you can't run it. So you need to be able to do something that can change the course that would suggest a better treatment. And for the most part, blood markers don't do that. All they do is show you baselines and make sure you're not creating too much toxicity when you're treating. And then what we would do is we would go through all of that. We'd make a plan. We'd talk about getting set up with the cancer test to look at how it's behaving, how the immune system's behaving against that, what it's susceptible to. It's really important.
Right.
Now we have the tumor behavior and the terrain, right? We get set up with a functional nutritionist. We talk all about lifestyle. What can you do within your home to make it a sanctuary? We talk about more testing to figure out underlying cause, what's out of balance, nutrients, hormones, detox, infections, toxicity, gut issues. Most of our immune system sits within our gut, sinus cavity, lungs, right? We'd be looking at optimizing all of that so that not only are we able to figure out what the best way is to target that cancer directly, but also what's the best way to balance the body so it can also assist us in taking that down, right? And then at that point, we would figure out whether a referral was appropriate, to a naturopathic oncologist who could do hypothermic treatments, IV treatments, once we know what's going to work well. We do sometimes referrals to psychologists if there is some level of trauma, neurofeedback, and getting that nervous system self-regulating. And then we're following up with the oncologist to get follow-up CTs, see if we're getting ahead of this thing, try to get in a relationship with the oncologist, so that everybody's on the same page with what's going on.
So it's very, very custom to each individual.
100%. Yeah.
It's as opposed to, I guess, the way I see the other way of looking at it or approaching it is kind of this broad stroke, one size fits all. So
everyone's on the same treatment.
Right. Yeah.
Yeah. You go into a cancer treatment wing, you'll see people that have the same cancer as you. You're all on the same treatment. And nobody's on a diet plan, nobody's on a nutrition plan, no one's on an exercise plan.
Even though we have all the information saying otherwise.
We do, but that's not considered a treatment for cancer. And so that's where we have to really open the conversation up of what is really the definition of conventional medicine and having a medical license is here's your protocol and we only treat disease. We don't treat the body. We treat this disease. We treat that disease. We treat that symptom. And it has to be that way, or they lose their license. They're not doing it out of spite or because they're bad people. They don't want to help you. They have their livelihood to protect too, right? So this license gives them a license to treat the diseases that have been characterized by the medical associations. Right, but above and beyond that, they're not going to be able to do anything for you, and I see that all the time. There's this frustration with that system, but they're doing exactly what they're defined and what they're supposed to do. We shouldn't be frustrated at them. We just need to understand that there's this other side, and we need to go find that for ourselves and align with someone like myself or Neurvana, right, and they can help guide me, right. It's kind of like I don't start a business without hiring a business strategist, right? Or I don't do my taxes without hiring an accountant.
Right. You don't get a root canal without a dentist.
Right. I'm lost without. So you really need to make sure you find a care provider on the other side too. And I personally think, and I'm maybe biased here, but everybody should have a guy on each side, and somebody who can integrate and somebody who's willing to work with both sides, right?
So is it something that could be entirely eliminated?
Conventional medicine?
Cancer.
Okay. That's on a different wavelength there. That's a deep question.
And if not, what's the second?
I think as a scientist, my viewpoint would be yes. I think we can. I think we can even go as far as preventing it, but we're going to need to do it as a culture and as a community. Philosophically, my philosophical mind says no, because it's teaching us something.
Right.
And I think autism is another one that's teaching us something. Like, hey, maybe we should do it differently. Maybe we should ask different questions. So I think until we learn what cancer is trying to teach us, I don't think it goes away. And that's on the individual level too. If I can help somebody find what that cancer is teaching them and showing them, it's the most healing, empowering thing in the entire world. And so that's, I think on my philosophical view is that.
I've never heard that perspective before. That's actually a really unique way of looking at it. It's like a lot of people want to eliminate pain, but that's trying to tell you a story. To look at something and to investigate.
Exactly. Yeah.
So maybe if you're not diagnosed with it, you're not going through cancer and you're not looking at that route, but you're still concerned, what would you do in terms of prevention then?
Preventative strategies, yeah. So a lot of these are in the lifestyle, decreasing toxic load, cleaning up the gut, getting the immune system functioning properly, good sleep habits, and then again, depending on your commitment to it, the test on cancer stem cells to see how are they behaving, because they're probably there.
Is that something? How soon do you think you'd be set up here at your office?
It's like right away.
Right away.
Yeah.
Okay.
Yeah. I've already been running one on myself. So,
okay.
Yeah.
That's good to know. I mean, you run it. You do the tests on yourself.
Absolutely.
You roll it out to clients. So,
absolutely. Yeah. I've done this test with. I've done this test with clients before, and there's another one that you can send to a university in Houston to do to analyze the biopsy if somebody has a biopsy,
right?
Which is really useful, the solid tumor. But of course, when you're in prevention, you don't have a solid tumor.
Right.
You can't send it on there, right?
Yeah.
There's another lab that does it, and they do amazing work.
That's interesting.
Yeah.
Great. Well, Corey, how can people get a hold of you?
Yeah, well, I guess our website, I'm sure there'll be a link underneath of the video. We're in Calgary, we're in Red Deer, we're in Kelowna. We're only growing, which is great. Hopefully we can spread as wide as we can, help as many people as we can. Our website's Neurvana, neurvanahealth.com. Yeah, our phone's 587-997-4649, and that'll connect you to whatever clinic. You'll get triaged to wherever you're closest to. I do video consults as well, so people can see me from all over the world. I don't require to see somebody in person. We can always make it work through shipping test kits or whatever else we need to do in dealing with local labs if we need to go that route. So
great, yes. So someone around the world could
absolutely
Zoom in or Skype call you and
absolutely
at least get some answers. And just to let everyone know that I was actually a client of Corey's. That's how we were first introduced. And I got more information in that. It was like a 30-minute call. I got more information in that call than 7 years of working with other people. There was more actionable advice in that call, and it was just I don't know, it just made sense, and we got more traction in that 30 minutes than anything else. So it's definitely worth giving you a call.
That's a good phone call.
Yeah, absolutely. So we'll have all the information posted below. So
great.
Excellent. Thanks, Corey.
Yeah, thank you.
All right.